guys, my name is Savannah. I'm a 23-year-old mom of an 11-month-old boy named Elijah. And here are some things that I did not know about breastfeeding before I started and before I started studying to become an IBCLC, as well as just some common myths. Number one, bland foods only. So many people while I'm breastfeeding have been like, how do you eat that spicy food or that cabbage or that broccoli? Most often the food that you eat is going to get broke down into your breast milk to a point where any potentially harmful or gassy causing foods will not affect your baby in any kind of way. The wait and see method is kind of the best way to go about it. When you're first starting out, just try to keep a log, or if you have a decent memory, of what you've eaten and kind of see how your baby responds to that. And then you can kind of test and tweak your diet around to see if that's actually the cause. The next one that I'm going to mention, and it's a big thing, this is a very common thing that you're going to hear when you leave the hospital, is you need to be feeding your baby every 2 hours, every 3 hours, whatever, schedule an amount. Watch your baby, not the clock. If your baby goes 2 hours one time and then 30 minutes later is showing hunger cues again, that's not to make you think that you are not producing enough milk. It is totally normal for babies to have very unique and individual appetites, just like we do. So watching their hunger cues and making sure they're having at least, by a week old, at least 6 wet diapers and 2 to 3 CD stools a day in those early weeks is completely normal, as well as making sure your baby is remaining on the weight curve. Nursing on demand will ensure that your supply is appropriate, so that your baby's getting what they need and your body is producing on a supply and demand basis. Okay, the next one is nipple confusion. That is a term you will hear a lot about as a breastfeeding mom in your early weeks breastfeeding. It is a common misconception that you cannot both bottle feed and breastfeed. There are some babies that will refuse the bottle or will refuse the breast after being given a bottle. However, if you wait until that breastfeeding relationship has been established and you've got a good supply and demand, you've got a good latch, that's generally somewhere around 6 weeks, you shouldn't have any problem switching between breast and bottle. I will tell you, however, that it may be in your best interest to only let someone else give them that bottle. That way that they kind of understand that they get it from the tap from mom, and that's what they'll always prefer. My son will not take a bottle from me, but he will take one from just about anybody else. Another thing that I have heard from my own primary care physician is that you should not nurse your son or daughter if you have a blocked duct or mastitis. The best way to clear a clogged duct is to nurse, and that is the way that you prevent mastitis. There is a certain point in time, if your mastitis gets bad enough, that you could end up in the hospital and you may not want to bring your baby with you. But there are plenty of antibiotics that are safe to nurse on. And like I said, the best way to prevent mastitis and a clogged duct is to just nurse, nurse, nurse. This is one of my favorite sensitive topics. Your baby will not sleep through the night until they start eating solids. You should put rice cereal in their bottle. No, your baby will start sleeping through the night when they're ready. Introducing solids before 6 months is not recommended by either the American Academy of Pediatrics or the World Health Organization. It can cause problems like leaky gut or stretch the stomach out and cause your child to become hungry more often. It is also a choking hazard to put solids in a bottle. The one exception to that, and it's still pretty debated on as to whether it's up to date or out of date information, is if your child has reflux and your doctor has instructed you to put a certain amount of rice cereal to thicken their formula. I don't really think I need to say a lot about this, but breastfeeding is not a form of birth control. You can still ovulate without a cycle. Breastfeeding your child after 12 months will make weaning more difficult. That is completely false. There is no evidence that says waiting past a year or 2 years or whenever would make it any more difficult to wean. Some babies want to wean right at a year, some don't, and that's all just going to be based on the individual needs and desires of your child. Your breasts will basically look like saggy socks after breastfeeding. That is false. That's actually, a lot of women do notice changes in their breasts from nursing, but your breast weight actually doubles in size during pregnancy. So the pregnancy weight is actually the main culprit of the change in breast shape or size. Nursing your baby isn't going to necessarily make your breasts hang lower than just being pregnant in general. And some women don't notice a change at all. Another good one. You have to stop breastfeeding if you get sick. Completely false. By the time you know you're sick, that you get those symptoms, your baby has already been exposed to whatever you have. And one of the many, many positive things about breastfeeding is that your body will create protective antibodies to prevent your child from getting sick. So if you do have the flu or whatever it is, it's in your best interest to continue nursing to prevent your child from getting whatever it is that you have. And if they do end up getting sick, they oftentimes get better faster and have less severe symptoms from those protective antibodies in your breast milk. Breastfeeding does not come easy to everyone. It's not either you know or you don't know, like right off the bat. It does take practice. If it hurts, you don't necessarily need to use a nipple shield or a bottle. If you're having pain while your child is latched on, you should see a lactation consultant to make sure your child doesn't have a lip or tongue tie, and just ensure that you have the proper positioning technique. And if you need to go to a nipple shield, that is still considered breastfeeding. You're still going to get that supply and demand. One more thing is that you will hear a lot of women say their milk did not come in. Colostrum is milk. If your baby comes at term, you're probably going to produce colostrum. It's very rare that you won't. The amount of time between when you switch over from colostrum to full-blown breast milk is going to vary between woman to woman, and it's totally normal. Stress will inhibit your letdown. That does not mean that you're not releasing milk to your child. Your child is going to be able to get more milk than your pump will, so never base your milk supply off of pumping. Your child's latch will produce a different amount than your pump will. You don't necessarily have to supplement just because you've had a big baby, because you had a C-section, or because your child is cluster feeding, which is basically when they act like they're hungry all the time because they're trying to establish the supply that they need to meet their demands. And in that case, you just keep latching. It's oftentimes so tempting to have someone tell you, let me give them a bottle and you can go take a nap or a bath. I strongly recommend not doing that. If you're pregnant right now and planning to breastfeed, that's one thing that you can encourage your family members to do, is to just give you a break when your baby's not hungry and bring you the baby when it's time to latch. That will ensure that you produce the right amount of breast milk to get that weight curve, to get that diaper output, and to not need to supplement or to fully switch to formula. my baby is crying all the time. It must mean I'm not making enough milk. No, babies cry for many different reasons. A huge part in that, in just those first weeks, is just being outside of this light temperature and sound controlled womb of theirs. They are adjusting to this new life, these new sounds, the new temperatures, the new smells. Like, their life has literally flipped upside down pretty much. So just give them some time to adjust. You know, if they take the breast when they're crying, they're hungry. If they didn't, they might be cold. They might be hot. They might be tired. Just because your baby is crying does not mean you're not producing enough milk. Babies cry a lot. While there are a lot of aspects of breastfeeding that are hard work, sometimes it takes practice to get a latch. For a while you may leak and you have to use breast pads. You're trying to figure out a schedule that works best or a sleeping arrangement that works best. You do have to pump if you're away from your baby for some time because you will get uncomfortable. Breastfeeding isn't necessarily hard work. The first few months, yes, without a doubt, I would say it can be hard work for a lot of moms, especially first-time moms. It's especially dependent on your support system. I was super lucky to have a lot of great women in my life who encouraged me to breastfeed, gave me advice, answered my questions. I have a great lactation consultant. I have an awesome OBGYN that's super supportive of breastfeeding. My pediatrician is super supportive of breastfeeding. And it definitely was some work at first because my son is lip and partially tongue-tied, so that was a little bit of an issue for us in the beginning, and he did have some reflux issues. Ultimately, I tell moms to at least give it a try when they think that they won't have it in them to be able to breastfeed. I always say, you know, you could either pick up your kid out of their crib when they wake up in the night and pop them on, or you could get up and go make a bottle. Same thing goes for when you go out. So either way, you're still going to have to get up and go, but in the long run, I think breastfeeding is a little bit more convenient and easy if you're out and about. You know, it's always there. It's at the right temperature. It's fresh. You don't have to pull it out of a bag and mix it up. And same goes for night feeding. It's just right there. It's available. My kid slept in my room till he was 6 months old, and I just, pop him on there in the bed. I doze off for a second and then put him back down. So for me, it was a little bit easier than I can imagine getting up and having to make a bottle in the middle of the night would be. So for a lot of new moms, I try to remind them that after the first, month and a half or 2 months of just getting used to breastfeeding, it can be a lot easier. Dads can still be a bonded part of the baby's life if you breastfeed. You don't have to let dad have a bottle to give your child before that 4 to 6 week mark. Or at all, even. My husband has maybe given my kid 3 bottles in the 11 months that he's been alive, because if I'm around, I'm just going to nurse him. I don't want to pump while he's feeding the baby. But there's plenty of other things that your husband or your significant other can do while you're nursing your child. They can bring you the burp cloth, a diaper to change into after, hot packs, your milk saver cup, a water bottle for you because you get really thirsty when you're breastfeeding. Dads can do lots of skin to skin, which is the main way to bond for breastfeeding or formula feeding moms and dads for newborns. They can look for those hunger cues and bring you the baby when they get hungry. They can change the diapers. They can put on pajamas. They can, play with the baby, sing to them, rock them to sleep, give them a bath. There's plenty of things that dads can do with babies for breastfeeding moms that allows them to bond. So it's a complete myth that breastfeeding, keeps them from other members of the family. Thank you so much for watching, and I hope you learned something today. If you did, this is my first video, so if you liked it or you have a comment or question, give me a subscribe, give me a like, comment below on something you'd like for me to talk about, or some questions you had, or something that you've learned in your breastfeeding journey that you think would be valuable information to other moms, and I would love to put it in my next video. Thank you so much.